Yes, I'm Stuart George. I chair NHS Buckinghamshire, the Primary Care Trust for Buckinghamshire. We're here for something we've called, if you'll excuse the pun, Health Here, because we feel that we need to do more engagement with the local population, with patients, with stakeholders, and although we hold all our meetings, our board meetings in public, this is an opportunity for us to engage and talk with people in a much less formal atmosphere. A lot of people are put off by board meetings. So this is just part of our communication process, but a very important one. And we're very pleased with the number of people who have come to see us today, and they've given us some very challenging questions. The purpose really is for us to get some feedback about things which we're going to do. So our main topic today was the IMPACT programme, as it's called, which is about unscheduled care. And we've had some challenge on some of those issues, and some issues were brought up about other parts of the NHS in Buckinghamshire, not necessarily to do with urgent care and unscheduled care. And those are very helpful to us. And we've also had some offers of support, which are always welcome when we're trying to get our ideas across in what's often a very complex way. Well, the benefits are that if we're trying to put the patient at the centre of everything we do, which is one of our values, then what better to do than ask the patients what they think about things you might be going to do. So this isn't a formal consultation, but it puts tremendous value for us into developing plans and the way in which health services might be delivered in the future. For example, about how much more we can do closer to home or in the home. And people's views about that are absolutely vital, because sometimes we find out at this stage that something isn't quite right, and it's much better to have that out in the open now so we can think about how we address it, rather than waiting until a formal consultation. It's a key way forward, because we can get a lot of people together, hopefully, if we can continue to encourage them to come, and judging by the number here today, we can do a bit more work, we can get twice as many. That would be fantastic. I'd love to fill a much bigger room, because it is one way of getting some quick views about what's going on and about what people see as important to them, because this has to be about the patient.